Welcome to the capstone and 5-year plan for ReshellRoss RN CNOR. Professional bibliography includes ReshellRoss RN CNOR. I am the clinical coordinator of general trauma surgery at Christus St. Elizabeth Hospital. It's a level 2 trauma center in Beaumont, Texas. I have almost completed the baccalaureate program at Lamar University and am a member of the Honor Society, and I will graduate May 2018. I took the initiative to become certified in my area of service, maintain my certification, Certified Nurse Operating Room. I am a member of AORN, the Association of OR Nurses, and ANA, American Nurse Association, professional organizations. I am also a member of the Safe Staffing Committee for Surgery Department and advocate for patient safety. I have worked at this facility for 17 years in multiple roles. I began as a lab assistant, went to school, obtained my LVN, worked on a neuro floor on nights as I got my RN. I worked in ICU for 2 years, became a nurse in surgery, and soon became the clinical coordinator of general surgery. I am able to float to different areas around the hospital and outpatient centers as needed because of my training, skills, and experience level from working the floors and the lab and ICU. I am also a preceptor for Lamar BSN students and enjoy orientating and training new associates. I am also a CPR instructor for the hospital. I enjoy activities with my children, which are 7 and 5. I also enjoy CrossFit to relieve stress from the day-to-day challenges that I give myself and to challenge myself physically. Spending time with my family and friends is a high priority of mine. I also like to spend time at Rayburn Lake near Jasper, Texas, watching my husband compete in bass fishing competition in various lakes, and I also enjoy relaxing and enjoying nature. How the 7 learning outcomes were met through the BSN nursing program. Number 1, practices safe, effective, holistic, patient-centered care to a variety of patients in multiple settings for global perspective by incorporating theories and evidence-based practice. We learned in Nursing 4540 in Module 1 the community assessment and discussion postings about how illnesses can affect a community and how easily a contamination can disrupt and even wipe out a community or a village. We also learned in 4540 about global organizations and their efforts that they have made to stop disease and disease progression. In Nursing 4540, we observed a small village where small children were playing steps away from a community restroom where no plumbing or sanitation was available. They could have easily contracted an illness and infected their whole community. We watched a DVD in Module 2 of 4540 that included a quiz about disasters and how the community resources would be deployed and dispersed. We also discussed how we as a community would start prioritizing the needs of the community to return to normal function. This objective was met with 100%. Number 2, supports patients in preventing disease, maintaining wellness, and promoting and restoring health, and advocating for death with dignity. We covered this in 1420. We assessed patients and interviewed the complete wellness and disease status of them and helped educate them on the need for wellness screenings, healthy diets, and other things specific to their condition. In Nursing 4390, the assessment qualitative article critique, I chose end-of-life education. In this article I researched, I learned that there is a need for new nurses to have more education curriculum about the death and dying process to help the family through this. It seemed to be more of a experienced nurse was more familiar with this and dealing with it than the new nurse. In Nursing 4540, we did an environmental health assessment, epidemiology exercise, and we learned about disease. This objective was also met at 100%. Number 3 evaluates patient-centered care for patients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. In Nursing 4580, the discussion Lewis Blackman's story helped us to learn about complex health needs and compromised health states. In 4540, we did an assignment called disaster planning. It covered all the practicums objectives listed above. It showed us different problems to consider whenever a community full of complex health needs and compromised states of health would need to be able to evacuate and what their specific needs were. Number 4, synthesis, clinical judgment, and nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. In Nursing 4316, we did an assessment of Brian Foster, who had chest pain. We used nursing process and critical thinking to find out his source of his pain. Nursing 4540, care of the communities, we had an assignment community assessment, which we had to use clinical judgment and critical thinking and research to help us solve that assignment. 4540, we did an assignment discussion 2, global health, and we had to use evidence-based practice and critical thinking as well as research to complete that assignment as well. The objective outcome met was 100%. Number 6, differentiates multiple role dimensions and practice within legal, ethical, and regulatory parameters when caring for patients as members of an interprofessional healthcare team. In Nursing 4550, Module 3, we had a discussion about healthcare leadership roles, which we had to identify and critique. In Nursing 4550, we did effective leadership and qualities paper. We learned effective leadership roles and assessed the style we work under and what we like and dislike about different leadership styles, as well as what we would do. I put this objective met at 95%. Number 7, demonstrates professional integrity, effective communication, and active inquiry in service to the community. In Nursing 4540, the assignment, the windshield survey, made us go out into the community and actively inquire about the people and services that serve the community. We had to use effective communication to complete this assignment. In Nursing 4540, disaster planning assignment, we took a specific population and we looked at them and how they could access the resources in the community. Nursing 4540, practicum teaching project, we had to use professional integrity and effective communication to explain what we needed for that specific population during a disaster based on the community services that we inquired and located for them. Put this objective outcome was met at 98%. My 5-year plan is to become a 5 family nurse practitioner. I am working towards my goal of moving closer to the lake and working at a Christus outpatient clinic in Jasper or surrounding areas. I would also like to teach health classes in the community or local schools. Teaching the community is a passion of mine. Community service also has a special place in my heart. Being visible and approachable, I think, could benefit so many in the community. I use the references listed below: the Digital Clinical Experience by Shadow Health, Professional Issues in Nursing book, the Lamar BSN Handbook, our other book, Guide to Culturally Competent Healthcare, and the Board of Nursing for Texas.